next month marks 2 years since the start of the COVID-19 pandemic. First responders are still on the front lines, seeing an increase of patients while facing staffing shortages.
That's why they are the focus of the second part of our series, COVID 2 Years Later. We're asking how has the pandemic shaped them. I sat down with emergency responders to hear their stories.
It's definitely more death than I saw in my entire nursing career. I don't think any of us were prepared for what we saw.
Jamie Duranda is a nurse at Mercy Medical Center. During the pandemic, her unit was closed down and she was moved to the intensive care unit, where she was by the bedside of people dying from COVID-19 every single day.
To have to FaceTime people to say their final goodbyes, knowing that they're never going to have that moment, and you're standing in for that family member as the person passes away, it's just something I never ever imagined having to do. Just lost so many people and saved so few in that first 6 months.
She says it was the worst thing she's ever had to face in her nursing career, and her experiences really took a toll on her mental health.
I didn't really understand PTSD or trauma until after I had kind of been out of it for a little bit and realized how much it had changed me.
Now she prioritizes self-care, and even though it's 2 years later and we have vaccines and treatments, Duranda says healthcare workers like herself still feel overwhelmed.
We're still overwhelmed and we're understaffed and just exhausted at this point. So I think healthcare has really suffered.
Dr. Mark Kenton also works at Mercy Medical Center as the chief of emergency medicine. Western Mass News asked him if there was one moment in the last 2 years when he realized just how bad COVID-19 was. Was there a moment for you that, you were getting everything together, but then you were like, oh, wow, we are living in a pandemic?
The first x-ray I saw, the first bilateral COVID pneumonia x-ray. That's the one thing that I remember seeing, and at that point saying to myself, oh, it's here.
Dr. Kenton says sitting by the bedside of COVID-19 patients was one of the hardest things to do because even his medical team feared what this virus could do.
Take that patient's hand and hold their hand. And remember that they were incredibly scared because there were no treatments, and they saw the news and they saw the reports, and they had that fear that they were going to die. And you couldn't tell them that they weren't.
Then he had his own fears that his staff could get sick.
How do you protect your staff from getting sick and dying? And then how are you going to care for all these people, if your staff start to get sick?
And on top of that, he was worried about himself and his family and bringing this horrible virus home to them.
It was that fear of, taking care of a patient and that fear of bringing it home to your family. That was a real fear for a lot of us.
And it wasn't just those working in the hospital that saw the death COVID can bring. Abigail Heineman is an EMT with American Medical Response. She started at AMR about a month before the pandemic started.
There's a lot of things you see and you experience that you won't forget, but I definitely noticed more anxiety issues. Just for a while, I was going through a really hard time.
She says her work in the field during this time really took a toll on her mental health, but the risk and fears of the pandemic never discouraged her.
I knew I was needed, and I wanted to see if I could do everything that I thought I could do.
And for all of those working on the front lines of the pandemic, they still held on to a sliver of hope. And for some, it was the people that they could save that kept them going.
He was a younger gentleman, and he did make it out of our ICU. He was there for months with us. He had 2 young kids and a wife. And when he went home, he was such a light of hope for us. And that's one of the things when I look back and realize how awful it was, that even though we did lose so many people, that we helped this family and that he is home with his kids and his wife.